Working with people in their homes really shows you so much more about who they are and who they have been for their whole lives, beyond just a little snapshot of time that you're seeing them in. My name's Kim Lowery Walker. I'm a social worker here, and I've been working with Capital Caring Health for about 4 years. So very often we run into situations where families are really struggling with a family member who needs additional care, more than they've needed in the past. And they're really trying to work through how they're going to manage that. And so the social worker can help both connect the family with outside resources, can help facilitate their existing support system and come up with some creative ways, and also look for sources of financial support where available for the family. And as part of that discussion, we talk about how people define quality of life, and what they want for themselves or their loved one. And that sometimes means choosing not to go to the hospital anymore, choosing not to be poked and prodded and tested anymore. And that's a big pivot and a big change for families. It can be a very emotional conversation. And that's part of our role, is to be that neutral third party that can provide education, can talk through that to validate how difficult that conversation is and how difficult those choices are. So a lot of patients I work with are in nursing homes, and unfortunately sometimes they don't have a lot of active family members, or have family members who are themselves ill and unable to visit as often as they would like. And so in those situations I really consider myself kind of the voice of the patient or family, and really making sure that we're working collaboratively with the facility staff to make sure that person gets the best care they can at end of life. I feel it is such an honor to be able to work with patients and families at such a difficult time in their lives. I can be a calming presence, a neutral third party that they can vent to and cry to without upsetting another family member. I can be the person that tells them about resources that can make the difference between a family that's really struggling and maybe making it just a little bit easier for them at a really difficult time.